our first monthly on Monday for 2026. So we have several deans on board today. Nimisha Parekh, who's the Senior Associate Dean for Faculty Development for HS faculty. I'm Brian Cummings, Senior Associate Dean for Faculty Development for Senate faculty. And then we also have Dean Kyoko Yokomori, who is in Academic Affairs and Senior Associate Dean for Senate faculty. So welcome. Today, we're going to be covering merits and promotions for Senate and HS clinical faculty. There's a whole lot of overlap, but a few key differences, and we'll bring those up as we go along. And I encourage you to be brave and interrupt. We're perfectly happy to take questions while things are going on. It's not a terribly long presentation. And then for those of you not taking notes, this presentation will be displayed on the Dean's website in the future, so you can go back and look at this recording. So there is a large group of folks. I kind of just mentioned them, but Academic Affairs, our leader is Dr. Jeffrey Abbott, who's Vice Dean for Basic Research and Academic Personnel. And then you have Deans Yokomori, Helmy, Cummings, Parekh, and Segal, who have various roles in the administrative works here. So you should reach out to your appropriate dean to get follow-up information should you need it. So just so that it'll be on our website, there is a structure here of who the support personnel are, who's involved with compensation and our training, administrative specialists, and then the various faculty analysts and for Senate and non-Senate faculty and volunteer faculty. So there's appropriate personnel depending on what pathway you're in, and you can refer to this chart, or again, you could email most of the senior faculty or the Jamie Holland and find out who's the right person to connect you with. As I mentioned at the very beginning, we're recovering School of Medicine Senate faculty and adjunct faculty. So those include inline or tenure track faculty, in residence faculty, and people who have a 50-50 appointment who are still Senate faculty, folks that are in the Clinic series who are Senate, and the adjunct faculty who are not in Senate series, and then also all of the HS clinical faculty who are in a non-Senate position. So key terminology and things to get straight in your head so that we're all speaking the same language. And that is, there's a difference between the steps of the ladder and the ranks on the ladder. So the ranks are essentially the columns of that ladder. The ranks are assistant, associate, and full professor at your various levels. And within each of those ranks, you have different steps. So a step 1 to step 2, step 2 to step 3. And as you go up in steps, that is essentially you're getting a merit increase. If you are moving across the columns, and you'll see this in a moment, if you move across the columns, that is what is considered a promotion. And then there's one other special promotion, which is when you're a full professor, step 5, and you're going up to a step 6. That's also considered a promotion. So here are those columns that I mentioned. Can you folks see my pointer? Good. I see some nodding. So if you're in the assistant professor column, if you're in the assistant professor column, then you're going up various steps here, and your rank is assistant professor. And as you move from assistant to associate, that is a promotion. Associate to full professor is a promotion. And then technically from full professor step 5 to 6 is another promotion level advancement that's reviewed by CAP. And also if you go above scale in the full professor series, that's another CAP reviewed level. And then if you are in the above merit scale, the above scale folks, there used to be what we called merit and a merit plus, and now that's been broken down into merit 1, merit 2, merit 3. And you can just see from this table here the minimum number of years that you need to be at that rank and step before you can move to another step on that scale. So this is pertains to very few people, so I'm not going to spend a lot of time on it now, but this is available for your review on the Dean's website. The what percent increase you get, whether it's reviewed by CAP or not, and how many years minimum you have to stay at those various above scale criteria. So what is the review process? And so being a state institution and part of the UC system, this is pretty much the same across the UCs, and it's very structured and ordered. The candidate, are responsible for submitting your file. You, of course, get help from your department analysts, and the department helps you prepare your dossier, but you're the one leading the information in that file. And so you're going to be pulling together your CV and your AP10, and we'll get to that in a moment. Your AP10 and your CV should match as close as possible. Certainly the number and ordering of your publications and your creative activity should match. And then you're going to be pulling together a research statement, a teaching and mentoring statement, and a service statement. The diversity and inclusive excellence is no longer required, and CAP likes to see that information of diversity or inclusive excellence included in your research statement if it's pertinent to your research, or included in your teaching statement if it belongs there as well. So you're pulling together your file with the help of your department. Your department is giving you information on how many years you've been at your various step and when the review process, when the files are due, and when the file is due in the department versus moving up the chain. Your department then reviews and makes a recommendation on your file, and that review and recommendation go to typically a Dean's Advisory Committee. So depending on what your series is, you're going to have a external School of Medicine Advisory Review Committee called ARAC or CXAC or CFAC for clinical faculty. And these committees are comprised of your peers, and their goal is to try to make sure that there's parity and equity across the various School of Medicine departments, because we're very broad and we have 4 basic departments and many, many clinical departments, and what people are expected of and what their creative activity could be in dermatology is not going to be the same in neurology, is not going to be the same as in biological chemistry. So these committees are there to try to help advise the dean and the departments about what are the expectations across the various fields. So these committees meet and they review the files, and they write a preliminary review that goes to the dean, and it goes to the appropriate associate deans, whether Dean Helmy or Yokomori, to give them feedback on what the recommendation is for review. And then I'll show you in a chart in a moment, but depending on what step you're at, that could then go directly to the dean and the dean's office for a dean delegated merit increase. If it's a promotion, though, it's going to go up to the vice provost's office for their review and comment, and it will go to the Committee on Academic Personnel if you're Senate faculty. And CAP, or the Committee on Academic Personnel, they have their own file presentation. They rely on your AP10 and your CV, but they're also looking at then the dean's letter, Dean Yokomori's letter for moving up, or Dean Helmy's letter. And then they vote on your file, and that goes to the vice provost and up to the provost and chancellor for final delegation. So there's a very structured and careful review process. If you have an initial appointment or a change in series, if you're going up for an acceleration, or as I mentioned, you're advancing from step 6 or to above scale, all of those go off to an ARAC committee or CXAC committee. Otherwise, those files are internal to the dean's office and go for a dean's delegated merit increase. But anytime your initial appointment, you're also reviewed by these various higher levels of review.
Brian, can I also add back on that slide for clinical faculty? We will adjust the slides, but for HS faculty, it would go to CFAC. The committee would review it here.
Thank you for that clarification. So what is the evaluation cycle? And you'll see more of this chart in a moment. Well, let's just look at the assistant professor rank and the various steps in that rank. Each step is a dean delegated review except for your mid-career appraisal. So and or if you'd go up for acceleration. So this mid-career, which typically happens between step 3 and step 4, or it happens within 3 to 4 years of your appointment here. So it does depend on what your initial rank is. But that mid-career appraisal goes off to ARAC or CXAC, and that goes on to CAP for their review and evaluation. And then you'll get a letter back from CAP, what their recommendation is and what their feedback is for your continued merits and promotions here. And typically within 6 years, you will be going up for a promotion from assistant rank to associate rank. That has to be done within 8 years because we have an 8-year up or out rule here. And that could be modified slightly by stop the clocks if you've had a specific need for stop the clock, which we'll get to in a moment. You have a parental obligation or caregiving, or if you were here during the COVID years and COVID affected your advancement up the ranks. So then the other ranks here, you're going from assistant to associate is a promotion. And then these little green bars here indicate dean delegated reviews. If you're in the associate level, at some point, whether you're an associate 3 and you go up for a promotion to full professor 1, or perhaps you're not ready, so you go from a 3 to a 4. If you go to a 3 to a 4, that's dean delegated still. And now if you're at a 4 and you go from a 4 to a step 2 full professor, that's going to be a CAP review. So depending on when you choose to go up for that promotion will be CAP reviewed. If you're staying within this rank, it would be a dean delegated review. So that could be a little bit confusing. And then, those are those overlaps that I kind of pointed out there. And those are dean delegated if you stay within the rank, and they're CAP reviewed if you're jumping outside the rank. Anything to add there, Nimisha? Did I miss anything?
No, I think you got it. I think it's important for people to think about this as you strategize your time here at UCI, and when to think about if you're at step 3, should you go up for a promotion or should you go up to step 4? And that's a discussion you can have with your chair. You can also reach out to myself and Dr. Cummings if you have questions as well.
So that's a great point. In fact, that at any time during the cycle, you should be reaching out to your mentors. Everybody should have a mentor. All of the associate deans are mentors as well, and we're happy to assist you as well. So you can reach out to us, and of course, you should be talking about that with your department chair. And something to be putting on your calendar is these dates. So we just got these dates, and email is going to be going out later this week so that your analyst and your department chair knows it. But you're hearing it here first. You should be meeting with your chairs to discuss what the proposed academic action is in the coming year. That should be happening in March. Your department has to say to academic affairs who's being proposed for what actions, and they notify us by May 1st. And then if the action requires outside letters of recommendation, so if you're going up for a promotion, for example, then your department needs to be soliciting the letters of recommendation by June 1st to give them time to respond. And then by August 1st, academic affairs will open the early file submission window. And depending on what the action is, there's various deadlines for when those files are due. So a standard promotion is going to be due November 2nd of 2026. Dean's delegated is also November 2nd. If it's a above scale action or just a non-reappointment, that can happen a little bit later. And please note that accelerated actions will not be accepted by the Academic Affairs Office after February 1st of 2027. So there's a very strict timelines and deadlines to meet so that we can process these files all in time for when the various levels of review are expecting them.
And it is really important to make sure you understand the deadlines, especially deadlines within your departments, because Brian, if you go back to the previous slide, you should be in discussions with your chair this March and April, so then your department will know what to submit for. And then you have from May, June, July, to get your file ready. And it is important that, remember, individual departments may have their own internal deadlines sooner than these because they have to review the files and make sure that everything is done correctly as well. So please do adhere to the deadlines.
And as noted in the chat, so we're going to repeat it over and over. Individual departments have their own internal deadlines. So talk with your analysts, talk with your CAO, talk with your chair. What is expected of your department? Because some departments are very small, but they have experienced people. Some departments are small and inexperienced people, so they're going to have different deadlines, different timelines, and different needs. So make sure you're on board with what your department wants. And I love the questions in the chat. When will we receive a copy of or will we receive a copy of these slides? So yes, these are not confidential slides. We'll be happy to share them. And hopefully Kathleen will send them out, the PowerPoint presentation or a PDF thereof afterwards to everybody who's on this Zoom call. And they will also be posted on the Dean's website. And yeah, with the recording will be posted as well. That usually takes a couple days, but we will definitely post this conversation as well.
Okay, so I'm going to switch gears, and now we're going to talk about what are the evaluation criteria. So in the UC system, you will, as faculty, you'll be evaluated on 4 buckets or 4 pillars. Number 1 is teaching and mentoring. The second one is creative activities, which also includes research. But remember, creative activities for HS faculty can also include curriculum development, podcast development, webinars. So we'll go over that. Service, and then your clinical activity as well. And so we just want to remind everyone, these are the 4 buckets that you will be evaluated on. These are what your statements will reflect as well. And the reason it's important to understand what these buckets are is, especially we get a lot of questions about acceleration. And so we'll talk about that near the end of our presentation, but I just wanted to make sure everyone understands the 4 buckets of evaluation. And so now we're going to go a little bit more in depth about each bucket.
And I would just point out, if you're a basic science faculty, I don't see anybody online, or yeah, I do see one. You're not expected to have clinical competence. So don't worry about that part. So what documents are needed? Do you want to cover this one, Nimisha?
Sure. So you will have to do your AP10. And so usually if there's any updates in the AP10, they usually come out in June of each year. So do keep an eye on that. We will need your CV, and outside letters are only necessary when you are getting an initial appointment and then for promotions or advancement to professor above scale. So remember, promotion is if you're going from assistant to associate or associate to full professor. And these letters can be from faculty from other UC campuses. However, they have to be non-conflicted. So if you are a co-PI with another faculty, they can't be writing your letter. And so it is important to understand the concept of when letters are needed and what outside letters are there. Teaching evaluations during the review period up to the last 5 years. Most clinical departments do have a system to collect teaching evaluations from their medical students, residents, and fellows. Please do check with your department so you understand what that process is. The other thing that documents that you would need is especially if you're HS faculty, you will need a reflective teaching mentoring statement. As HS faculty, if you're doing research or creative activities, you can submit a statement to that, but it is only if it's applicable to what you're doing. And a service statement is not required, but can be recommended. If you're basic science faculty, the same things apply. But remember, they don't want to see more than 3 pages maximum for each statement. Now, an inclusive excellence statement is only required for your initial appointment. It's optional for merit or promotion. But if there's something you want to highlight for some work that you've done, you can include it in your reflective teaching and mentoring statement. If it pertains to the research and creative activity you're doing, you could include it in there, or you can put it as a separate statement. And so, and remember, as said in the chat by one of our wonderful analysts, is please do check with your department analyst about the statement length, because they are different for promotions versus merit. So for promotions, a little bit longer. If you want merits, a little bit shorter. That's another way to think about it.
And then lastly, I would add, because what sometimes glitches people is the teaching evaluations, and they get a couple years in and they find out they don't have teaching evaluations. And our response to that would be, what have you been doing the last couple of years? Why haven't you been checking in to see what your evaluations are? Because the story isn't wait till you're about to go up for a merit or promotion and then go find out what your teaching evaluations are. You should be checking them every quarter or every year and reflecting on them and thinking, gosh, I do the A and B really well, but students aren't catching on to P and Q. So how can I change that? And the other thing I would mention there is that nobody expects you to be perfect, and the even the dean's office doesn't expect that. What they expect is that you have reflected on it and that you have a response. So your response could be, students hate my slides. They have too much information and too much overload. And so what have I done about it? Well, I went back and I changed how I present things, or I flipped the classroom, or what is it that you did to address the comments? And conversely, and this has happened too, is you might have student evaluations that say, well, they're providing me too much information about the anatomy of the cranial nerves. And you could answers like, that's nice. I don't care. You need to know the cranial nerves. So I'm going to keep doing that. And I'm the educator. I know better. But the point is that you respond to it and that you have an appropriate response. So just keep that in mind.
All right, so we're going to talk about different things. These pertain to what you will be filling out in your AP 10. And so really for all faculty, teaching is essential for advancement, but also very much so for HS faculty. And remember, teaching is all different types of teaching. It could be a formal course, like in a classroom or a lab. It can be informal teaching, like on the clinical side within the wards, operating room, procedure rooms, clinic rounds. And so there are two big buckets of teaching. You're either teaching medical students or you're teaching trainees such as residents and fellows. And on your AP 10, there are two different parts where you fill out what you're doing for teaching of medical students and then what you're doing for teaching of trainees. And more weight is given to the teaching activities for which evaluations are provided. So if you are new to your department, please do reach out to your administrator to understand the specific information on the teaching evaluation that is sent out to either the students, residents, and fellows. Now, there's also mentoring of graduate students, postdoctoral students, undergraduate students, visiting scholars, and lab personnel. And so that can be included in the teaching and mentoring. Now, if you are mentoring early career junior faculty, that can be considered service. I would not recommend to put that in the teaching mentoring bucket here in your AP 10. I would put it in the service bucket. Brian, anything else?
Well, no, I was just going to say I accidentally skipped a slide, which is a boring one, but these are the buckets that Nimisha is referring to. Is when you finally open the AP 10 and see what you're expected to do, it's broken down in these very formal sections. And then under section 2 would be 2A, 2B, 2C, which is where you're putting residents versus fellows versus undergraduates. So just don't open the AP 10 a week before it's due. Definitely you want to be thinking about it much sooner than that and looking for what record should I be taking now so that I can keep my AP 10 up to date. So now I'll jump back to that slide. So the junior faculty career development, you want to be thinking about this in terms of, are you doing department service by mentoring others? And conversely, you might interpret this as, if I'm a junior faculty and I take training myself to be a better mentor, then I could put that down as I'm improving my teaching skills by taking mentorship training. It all depends on what bucket and what the training is that you're referring to.
And so just to reiterate, there is a reflective teaching and mentoring statement. And really, you want to include what your philosophy towards teaching and mentoring include, what your engagement in your teaching evaluations were. As Brian said, this is somewhere if you had one or two negative evaluations, you can address it here. Remember, and then if there is a major issue, make sure you check in with your chair, or some departments have a committee that writes the departmental letter. Check in with them that they're mentioning how it was addressed as well. Remember, a lot of us do a lot of informal mentoring, and you can you can document that in your teaching, in this statement, what you're doing, how you're doing it, the time commitments, what the outcomes were as well. But remember, please do not put any names or identifying characteristics on your AP10 or reflective teaching statement. We do want to maintain the confidentiality of our students and trainees. And then, as we said, student evaluations of your teaching can either be from students, from the graduate students, from the residents and fellows. And remember, just check in and make sure you understand the process in your department.
Okay. And as mentioned before, but just to reiterate, nobody expects perfect teaching, but teaching is very important to the institution. So what they want to see is that you are responsive to the teaching statements, that you have a plan, and you have a plan moving forward if there are issues that need to be addressed. And that's, always something you should be talking to your mentors and your department chair about, is what's good, what can I improve on?
Okay.
All right.
Now,
So
second bucket is research and creative activity. I'm going to talk about it from the HS standpoint. I'm going to let Brian talk about it from the pure research standpoint. And so, a lot of clinicians, many of us are doing creative activity. We may not be doing, randomized controlled research, but if you are putting together a curriculum, you can either put that in the teaching section, but if it's a curriculum that you're doing and then evaluating its intervention and outcome, and you wrote a paper or you had an abstract, this is where you can put it as creative activity. If you put podcasts together for teaching or for a clinical project, this is another area. Curriculum development. Because remember, the AP10 is used by all schools, not just the School of Medicine. So if we think we have, School of Arts faculty that are filling creative activity workout as well. And so remember to include what your role is, what your impact was, and, how much. Some of them you can also include the percentage time that you put in it as well. I'm going to hand it over to Brian now.
all right, so that was a great overview. And for research faculty, of course, you're going to be putting in what publications and what your research is, and more importantly, or equally important, I should say, is what's the impact of that research. So, as Nimisha mentioned, if you have a colleague on CAP who's voting on your file and they're an engineer or they're in the law school, they don't know that the Journal of Bioengineering or the Journal of Neuroscience is a really prestigious journal. And they don't know if you're, say, a middle author, but you provided the data set that without that data set, this paper couldn't have happened. But you weren't the lead of that laboratory. Your job on your research and creative statement is to explain. Thank you. Your job is to explain what was your role in this research. What did you do? And if you have 10 publications, you don't have to be the lead author and the senior author in every single thing. There's nothing wrong with being a collaborative middle author. You don't have to make everything the greatest thing in the world. It's just part of your collaborative work that you do here. On the other hand, if you're a new faculty here, and you're in the Senate series, you need to be showing that you have a domain of work that you are responsible for, that you're known for, and that you're building up. So what is the importance and what are the future direction of the body of work that you're working on? So that's going to vary depending on whether you're inline faculty or clinical X faculty, where the expectation is slightly different. It could be clinical research, leading a clinical trial. But your job is to explain to peers that are not in the field, explain what is important about this work and why it should be something that you should be giving credit for.
Okay.
All right, so I guess I'll take this part here. For Senate faculty in particular, although nothing wrong with Clinics faculty and HS in publishing in peer-reviewed journals, that is the gold standard of academic work. This includes case reports, review articles, and again, you could write a review article and it's in a peer-reviewed journal, but CAP isn't going to know that unless you tell them, unless you put it in the right category on your AP10 form. If you are Senate faculty, first authorship or senior authorship, corresponding status is crucial for your tenure and your various steps of promotion. Middle authorship is fine, but you need to document and explain what it is that you did and why you're in that role. So did you supply a crucial resource? Were you the expert data analyst in that area? Did you do the statistics or help somebody out? Don't assume that CAP's going to understand your role. Your job is to explain it. The other thing you can do is explain the give impact of how that paper metrics compare to others in the field. It's not required, but it's helpful to say to CAP or your department, in fact, if they don't follow your field specifically, that this might be a low impact journal, but it's the highest journal in my domain. So it should be respected more. You could provide your H-index or eyesight information about the individual productivity of your articles. A little bit less important now because we're able to track individual articles is the impact factor of a journal. Because over the years, the question isn't the journal so much as is your work specifically getting cited, and that's tracked better by the H-index or something you could find on Google Scholar or Semantic Scholar. So provide your department with that information. Don't make them hunt for it. And hopefully have those conversations with your mentors and your department chair about what is the impact of the work that you're doing and what is your role in various works that you're not the senior or first author on. Anything to add on that, Dr. Yokomori?
Just the CAP is always looking for context. So make sure to provide that in your personal statement. The personal statement for research and service are not required, but it's always recommended, especially for acceleration or promotion.
And anything else from your perspective, Nimisha, before I go to the next slide?
Nope.
Okay, so next slide, more on research creative activity. So extramural funding, particularly if you're a Senate faculty member, how are you going to keep your lab going and keep your research activity going? There's no set number for this because a lab might be very bioinformatics based or AI based and need lower level funding than a lab that has animal colonies and very long-term experiments. So you need to be describing to CAP in your research statement what is your role? Are you on a multi-PI grant? Are you site PI on a clinical trial? Do you have research projects that have IRB approval, but the clinical trial isn't funded yet, but you're involved in it and there's a lot of work involved? You have to help people understand that context. If you're Clinics faculty, publishing in peer-reviewed journals is still expected, although there might be case reports or review articles and maybe less senior authorship articles, but again, provide the context for that work. And are you developing teaching materials that could be cited or maybe new content for websites, new teaching materials? Are you involved in clinical trials? Have you been involved with FDA pre-IND or IND meetings? Provide that context, and that's considered an important piece of creative activity as well.
And if you're on a sponsored clinical trial where you're the site PI, it's important to know also the dollar value that was negotiated and contracted out, because you will have to put that on your AP10, and that you can get from your department, CAO, or even from your CCR team. They should have, your finance person should have that information as well. That's where you would put this information.
Okay. Jump to slide 2. So professional recognition and service activity. So this is true for HS, for Senate level. You should be keeping track of your awards and honors, any media coverage. Are you involved in professional organizations, clinical or otherwise? Are you on an editorial board? Do you review manuscripts? Are you a section, study section member? A grant reviewer, what grant organization? If it's NIH, everybody should know what that is. If it's a foundation, you need to provide that context. If I review for this foundation, it's the most important foundation in the area of eye, degeneration. You have to provide that context for CAP, or it's the second most prestigious foundation. Keep track of all your invited lectures at other institutions, at professional meetings, accepted abstracts and posters for yourself, for your people that you mentor, for people in your laboratory. And also you should be keeping track of your community service outreach. Are you giving talks to the Elk Club or local foundations? Are you doing service in that regard? And are you mentoring other faculty within your department, within your school, or even across schools? And then perhaps Dean Parekh can talk about clinical competence, since I can.
Clinical competence. If you are listed as an Orange County Physician of Excellence, this is the section you would put it in. If you're getting an award from your national society or even from a foundation, that's important. If you wanted to, even in your personal statement, you could include your NRC scores if that's important to showcase how well you are doing clinically. Board certification, you do need to maintain that. And if you have any leadership roles in your division or your department, the other thing for service in this section to include also is if you are interviewing trainees for your residency or fellowship training program, that would be included in here. If you are working on your CCC or PEC of your training program, that would also be included under service activity. And then, in the AP 10, the next slide, as Brian showed real quick, one right here. There are different sections on your AP 10, whether it's department, School of Medicine, campus-wide, or UC-wide committees. Hospital committees, we encourage everyone to put it under the School of Medicine section because a lot of HS faculty are working on different committees in the hospital. If you're working on a QI, if there's so many different committees we have in the hospital. So if you're doing that, put that under there. If you have a leadership role, that would go also under School of Medicine. We do like to remind people, those who are at the assistant professor rank, less service is expected. If you are at the professor rank, more service is expected at the higher ranks. And so the reason is, especially for Senate faculty, remember, campus-wide service is expected to ensure shared governance in the University of California system. And so you are doing a lot of different service activities. Remember where to record them. If you're unsure or unclear, reach out to your department analyst. And once again, you can always reach out to any of the senior associate deans, myself, Dr. Cummings, Dr. Yokomori, or Dr. Helmy.
All right, so I would just add, think of those columns we showed you of the ranks and assistant, associate to full. And as you move across those ranks, then the expectation is that you're not just doing department service or department and School of Medicine service, but now you're also doing campus-wide service. And now you become a full professor, then you should be doing UC-wide service or nationally recognized service. So the expectations grow as your ranks increase.
And the other thing we didn't mention on this, but Dr. Rivera put it out in the chat, is under each of these buckets, there's a section on your AP 10 about professional development or faculty development in this area. So as he said, he's attending this workshop, any monthly on Mondays workshop you attended, or if you watched it as a recording, you can list it under your professional development section. And so depending on the topic, you can put it in that bucket accordingly.
All right. As in all things CAP and AP 10 related, context matters. And this is why, by the way, I just kind of a side note is don't have an assistant fill out these forms for you. They don't know the context. And think of it as your peers across campus are going to be reviewing your file, and they need to know the context. What do you want them to know about the service activity or about your teaching that gives them the better understanding of what role you played? So CAP's going to want to look for your increased level of leadership and effort, not a long list of details, but that you say, if I'm on a committee and that committee meets once a week, that's a lot of service activity, but CAP can't know that unless you tell them this is a weekly committee. No, this is a monthly committee. This committee meets quarterly. Provide that information, and whether it's compensated or not. Is this typical for your department? Are you doing the average in your department? And that's fine. But are you well above average? Your mentors and your department chair should be able to help you with that so that you can point out, I'm doing much more service than the average person, and maybe I should be accelerating. We'll get to that in a moment as well. So if you're on an editorial board, are you editing one paper a year or one paper a month? Provide the context. Okay, so inclusive excellence, as we mentioned earlier, we really would rather see this information in your AP10 and in your research, teaching, or service statements rather than a separate file. Now, on the other hand, if you are very dedicated to a particular inclusive excellence domain and you're running a foundation or you've started a club, you might want to have a separate inclusive excellence statement, but it is not required. And Nimisha mentioned this earlier, but do not include personal information or names that could be traced back to somebody in this information. You're just going to get the file returned to you, and it'll delay things. So the nitty-gritty. Promotion to associate professor requires regional or national recognition for research. You should be showing that you're an independent investigator and demonstrate excellence in teaching, excellent professional activity, and appropriate service. So teaching, evidence of independent research that is attracting extramural funding if you're in the Senate series, professional recognition that you're a journal reviewer, you're getting invited talks, and that you're doing some appropriate service activity. It can be limited, but you're doing something that you can demonstrate. And as you move up higher, a promotion to full professor requires national or international reputation for research, continued excellence in teaching, and highly meritorious service, and also excellence in professional activity. So this should be at a regional or national level for clinical activities. And in research excellence, teaching, and professional activity, we want to see highly meritorious service and maybe a leadership role in a department or a hospital level committee as well. And then we note that if you're in the adjunct series, we only require 2 out of 3 activities, research and teaching or research and service, not all 3. Anything to add there, Nimisha?
Nope.
Okay, and I see Kyoko nodding her head as well. So Clinical X series. So ClinX emphasizes clinical duties, teaching, and creative output. Although it's not a tenure track position, it is a Senate level position. And the research expectations are there, but they're not quite the same as for tenure track faculty. Specifically, ClinX faculty are expected to lead or have a significant intellectual and substantive contribution to a research program and or be involved in other creative activities. They may be highly integrated with their clinical activities, and that's actually very common that ClinX faculty are doing research in their clinical area. And it may include clinical translational projects, health science, health outcome research, case series, educational scholarship, and or bench research. Well, that's a little less common. Extramural support is desirable, but not required. It really does depend on if you're doing clinical trials and the clinical trial funding is what's covering things, and you're not running a wet lab, then you wouldn't need as much extramural support. And although it's not a tenured position, it does confer membership in the Academic Senate series, and it's reviewed by CAP.
It's also important to remember University of California is one of the few health systems that has this Clinical X series. And so it's for that, physician, a lot of the physician scientists are on this track. It's the physician who may be doing a lot of clinical research. They maybe want to be on this track. And so you know, there are some benefits to being on the Clinical X series, but many times you can still stay in the HS series and do similar work as well.
And like we just showed for Senate series, the ClinX series for promotion to associate requires local or regional reputation in creative activities, excellence in teaching, and appropriate university service, as well as distinguished accomplishments within your clinical specialty. So then you have that, because you're clinical, you have that clinical bucket as well. Promotion to professor requires regional or national reputation in creative activities, excellence in teaching, highly meritorious service, and superior accomplishments within your clinical specialty. And you may have a leadership role in the department or the hospital as you move up the ranks.
Brian, can you just stay on the slide for HS? We didn't make a slide for this, but we will add it for the slide set we send out. It's very similar for HS faculty, but really the focus is on teaching, your clinical activity, and then service, but creative activities as well. But more emphasis is put on your clinical and teaching. And then to get to promotion to professor, does require excellence in teaching, in your clinical specialty. You should have a regional reputation. And then also if you have service activities.
Okay, so I need more time. Isn't that always true? What can you do? You could have no action or a reappointment at the assistant professor level, a formal review, but no merit increase or promotion. So you can do 2 consecutive no actions, but if you do so, you need an action plan with measurable goals and a subsequent progress report as to why you were doing no action. There could be stop the clocks at the assistant professor level. And if you were hired, you have to have been started before June of 2022 to have a COVID stop the clock. And you can also have one stop the clock for personal or family reason, that maybe you have caregiving responsibilities for either your own children or for your parents or a spouse. And there are formal paperwork you have to do to get that stop the clock, but it is possible. If you're an associate or a professor, you can defer. If your last review is positive, then a merit or promotion review can be deferred for 1 year. So see the fine print there. This is kind of unusual, so we won't go into the details given the time constraints, but we're happy to talk about it if you need more information. Should I accelerate? So what is an acceleration? This can be a 1 year or a 2 year or whole step acceleration. In order to accelerate, you have to be outstanding, not just really good, but outstanding, far above the typical accomplishments in 2 out of 3 areas. And one of those areas has to be research. So it's either research and teaching excellence or research and services outstanding, and at least satisfactory in the third area. So if you're unsatisfactory in the third area, you're not going to be able to accelerate. So
Now,
then
for HS faculty, though, it's 2 out of the 3 categories. Clinical and teaching should be outstanding. And then, hopefully also you have something more that you've done than what you would have done for your regular merit.
All right. And then you also need an analytical rationale for the acceleration. You're outstanding, but in which 2 areas? And this outstandingness has to be included in the department letter. And then CAP will also consider excellence in activity related to diversity and broad impacts of inclusivity as a criterion for acceleration if all other areas are similarly strong as well. So it's a high hurdle to accelerate. You should talk to your peers, your mentors, and your department chair before going up for an acceleration.
Another way of thinking about it is if you were to go up for a whole step acceleration, meaning if you're going to go from a step 2 to a step 4, you have to accomplish 4 years worth of work in 2 years. So you have to have done a lot of extra, but that's a good bar to think about it. Now, if you're doing a 1-year acceleration, meaning you're just going to apply 1 year early for your regular merit, that's still considered an acceleration. So usually if you're in the assistant or associate rank, you would be going up every 2 years, but you've decided, hey, this past year I did a lot and I feel like I should go up earlier. Then it's doing 2 year, you're just applying 1 year earlier. That is another type of acceleration. So there's the whole step or just applying earlier. But remember, it's just accomplishing the amount of work that you would have done in the 2 years, 3 years, 4 years in a shorter period of time.
Right. And so, for teaching, you can't actually double your teaching load. It's not expected, but your impact, because you've created a new course, for example, or you've written a textbook, your impact should be twice as high with evidence of leadership in that area. But your volume of service output, your volume of creative activity should be double if you're making a double step. So if you note here, we have some data from the past that 31% of all cases are proposed for an acceleration. And then accelerations recommended by CAP are half of those essentially, or 16%. So if it's a 1-year acceleration, it's more likely that you're going to be successful, and a full step, a 1-step acceleration is more difficult, as it should be. So this next slide is in fact a duplication of that data, so I'm just to skip over that. So what could happen? CAP may deny a promotion or a merit or acceleration. What happens then? Now, CAP generally doesn't get involved with merits, but they're certainly involved in accelerations and promotions. So as per the normal process, faculty going up for a promotion to associate can add new materials until the final decision is made. So although there are strict time deadlines for most things, when you're going up for a promotion to associate rank, CAP is always willing to accept that last grant being accepted or that paper finally being accepted. You can, of course, add that to your file. If there's a tentative decision from CAP requesting additional information, then it's optional and not mandatory. Where there's a disagreement between CAP and the school, you may decide to accept that decision or withdraw your file and resubmit the following year so that you can strengthen your file. Although that withdrawal is subject to the 8-year rule. So you definitely want to be talking to your analysts and your department chair or the associate deans about a decision to withdraw a file. Kyoko, anything to add on that?
Yeah, so I think it's a little bit data is confusing, but last year, actually the full agreement by CAP for acceleration was like 20%, 21% overall. But for School of Medicine, it was about less than half of accelerate file, the CAP was in full agreement. And actually the merit regular promotion advancement was only 70% was full agreement by CAP. So just please accept or expect that the CAP may not agree with what you and department and advisory committee and dean recommended. So
Right. And I would just add to that is that, and that's CAP's job. Like your department's job typically is to be a cheerleader and to want to help their faculty along, but CAP's job is to balance things out across the entire campus. And so it's to be expected that they say, well, that's nice that you want and school of medicine wants something, but we have to keep this in line with engineering and social sciences and everything as well. So that's their role.
And also, we strongly recommend that you consult with the chair and before deciding to go for acceleration. This is not something like, oh, what the hell, just try it and see. And, if it doesn't work, I'll do it again, because we have to maintain some integrity and standard for School of Medicine in order to for the CAP to kind of treat us, with respect in terms of judgment. So just please think carefully. But if you're doing really well, by all means, you should go for it. But just expect this kind of discrepancies.
Yeah, right. We're not Lake Wobegon. Not everybody is above average. Okay, so my activities and duties have changed. Should I switch series? So a switch in series is essentially a new appointment for an individual whose last appointment was in the UC system, and it's usually a switch in faculty title, say from an adjunct professor to in residence or HS to clinical X. So it may occur because your duties or your interests have changed, and it's going to require an academic review, and typically a competitive search is required. So keep that in mind, and also keep in mind, it's a really important point, is that you can only change series once. So if you're an HS clinical faculty and you want to become ClinX, for example, and you change series and things don't work out, you can't just jump back to HS clinical. So it's an important decision to reflect carefully. So again, consult with your deans. Should I switch series? So I mentioned it's only allowed once, really important. If you want to switch to clinical X, your creative activity related to your clinical specialty is necessary in addition to clinical teaching, service, and clinical excellence. If you have research grants, it's not necessarily required, but clinical research, trials, your site PI, in which you have a leadership role and peer recognition, and that's going to be a requirement for ClinX. So if you need two out of the 3 categories necessary for career advancement. So if you
and it's also important, once you may think, oh, I have all these papers, I should switch to ClinX. Remember, you have to maintain that level because you still have to go up for merits and promotions for the rest of your career. So it's not just about switching one time, you have to maintain that creative activity in Clinical X.
Exactly. Well said. So in residence, so if you're in residence, it's a yearly contract and your salary is covered by grants or your department. The requirements for career advancement are the same as inline series. So if an FTE inline position opens, by all means, you should try to compete for that and take that position. The department needs to have an FTE or a full-time equivalent to hire someone in the inline series. You can't just switch there because it sounds great. So although your 11-month salary is covered by the state, you are expected to have research funding, extramural funding as the PI or multi-PI to maintain your position in an inline series. And you'd be expected to have accomplishments in all three areas: research, teaching, and professional university service. So if you're in the adjunct series, you need to be covering your own salary, but you only are, as you move up the ranks, only expected to have 2 out of the 3 categories necessary for career advancement. And then keep in mind the sub note here that switching between in-residence and inline does not restart the clock. So if you're already 4 years in, you don't get a new clock reset. You've got 2 more years essentially to advance. Restarting the clock means that you cannot include your accomplishments in a previous series in your AP10 for subsequent merit reviews. You can keep it, of course, on your CV, but it isn't part of the review process of your AP10. So again, complicated, not very common. Consult with your local dean. What early career faculty mentoring mechanisms are in place? So we've mentioned repeatedly that you should have a faculty mentor. It's assigned at the time of hire. Many departments have department mentoring committees, and there are, of course, your senior associate deans for faculty development. We meet with everybody after their mid-career appraisal if they're in the inline series. We invite you to attend an ARAC or a CXAC meeting up to 2 times if you're in the inline or ClinX series. And there's, of course, this One Thing on Monday series as well for everybody. If you're in the inline series or expected to write grants, you might consider attending an NIH boot camp to get assistance and training in writing extramural grants. There's a National Center for Faculty Development that has a faculty success program, which is now online, that you're encouraged to take. And there's also school medicine mentoring committees for mid-career appraisals, and committees covering inline and in-residence faculty, and also a subcommittee for ClinX faculty. So there's a lot of mentoring mechanisms out there. Be sure to avail yourself of the one that fits your series the best.
Brian, can I also add, just for HS faculty, HS faculty, you do get a mid-career evaluation. It's not as rigorous as for the other Senate series, but if you have any specific questions, you can reach out to us. I would highly encourage you to attend monthly on Mondays. There's also going to be coming out later this week a mentoring faculty development event in April. And so that will help you become a better mentor. You'll learn about different mentoring techniques, so you can include it for faculty development. And so do realize that we do have a lot of different resources that we have been developing for HS faculty, because a lot of the mentoring was developed for the Senate faculty, but we do have a lot of different things for HS faculty as well.
And that
there's a new faculty orientation that's being developed that's going to be in person as well as virtual. So you are, as faculty, you're welcome to attend those too. You don't just have to be new faculty, and we'll be sending that information out to your departments in the next few weeks as well.
Indeed. All right, and we're almost out of time. We're happy to take a question or two, but there will be this slide with working links to the various resources available to you. So thanks, everyone. I want to thank my co-deans, Yokomori and Parekh, for assisting, and also all the analysts and people in academic affairs who are on this call as well. Really appreciative of their work and support.
All right. Thank you. And thank you for coming to spend the time with us. And I would encourage you to have if you have your other faculty, watch the presentation as well. So thank you and have a good evening.